I never knew anything about research until I got involved in this. So
I've never heard of the IRB.
No good research uses people.
Normally when I think of community-based research, I think about going into neighborhoods, asking questions, trying to find out how to be effective in a particular neighborhood or community. I think some of the researchers get a bad rap because they don't understand the neighborhoods that they go in. They go in with an idea and a project, and it's just to get the project done.
I think first, just building and establishing a relationship with the communities and targeting interests that interest the community.
It is hitting people where they are and hitting them with some degree of respect.
I think you should at least get the community leadership involved with the neighborhood so that they know why and what you're doing, because you'd be surprised, a lot of these families do trust that leadership to guide them.
Speak with their people like face to face instead of having like a representative speak for them. Actually go up to the people that they're fixing to do the research on, meet them, meet their kids, see if they can relate, kind of make them feel a little more comfortable in the environment that they're going to be in.
You need to remember that it took a while for that agency to build trust in that community, and to have an outsider come in is a little bit intimidating if you think about it on a lot of levels. But by taking some extra steps, I think that you can prevent that, and then you can get on with the research.
Grassroots research can't be done without low-income people at the table.
The general population views academic researchers with some degree of suspicion.
A lot of the clients that we serve, when they hear the words research, it often comes with a negative connotation.
But why should I give my personal information to some individual who may not understand it? They may not understand the context in which it's offered. They may end up doing next to nothing with it.
I'd like to know who's doing it, their accreditations, how long they've been in the field, stuff like that. And essentially I'd like them to break it down, because I'm pretty basic. You have to break things down for me. So I would want them to break down essentially what they're doing, how they're doing it, and stuff like that.
Communication problems that can come up in research can be as minute as saying the wrong word.
That the idea of higher education, college, and the ivory towers, for lack of a stereotype, to some parents that's very intimidating.
A communication barrier in speaking the language of research versus speaking the language of programs. And I think sometimes that, it's really important for researchers and programs to learn how to talk to each other a little bit.
And things are going to come up, and then you just need to be able to have an honest dialogue.
We got a letter in the mail from OSU wanting to do cognitive research, and we just don't have the time to do it.
How much more can I ask my good frontline staff person to do? So if there was more money available, to offset some of those hours, or to create more hour time for those staff that would be the record keepers, I think that would be great. I think that would get more of a buy-in from community agencies.
I've heard a lot of pushback of not wanting to participate. It's just something extra they have to do, and they don't see how it benefits them.
For some families, when it comes to research and being involved in something, that incentive can be very helpful. You may be able to get people there that wouldn't necessarily make the arrangements to come, to find the babysitter, or really, honestly, just people that are struggling with the basics. And if some of their basic needs can be met, they may be more than likely to participate when they weren't in the past.
And I think the other barrier that sometimes comes out there is just fear in the community of what research is and how it's going to be used.
Some people that have done research before, answered survey questions before, they already have a certain idea of what it's all about. And most of the time they just get concerned when the questions get personal. They would rather tell you that they have dyslexia than to tell you how much money did they make.
People are worried that the research findings or that information or a lot of that personal information that gets drawn out may be used against them or used to deny them services or benefits.
We say it's confidential and absolutely protect it to the bone. It is very difficult for folks in poverty to believe that, and that somehow it won't be traced back to them or somehow used against them.
Then after they get past that barrier of, okay, so what are you going to do with the information? And like I just said, if nothing gets done, then most people think it's just a bunch of garbage. And the next time I may participate and I may not, depending on what the incentive is. If you give me a large enough incentive, then I'll help. But I don't think that your research is benefiting me. It's just something that the students are doing to try and graduate.
I have really never met a parent who hasn't want their child involved in a research project as long as they know the full rollout of what's going to be expected and that it's nothing scary and that it's for the benefit of their child and the benefit of the greater community. But I think if you don't put the necessary steps in place, that you never get to that part.
I've never heard of the IRB. Safety is the main thing, and if they're there to review that, then, or if the IRB, yeah, if the IRB is there to review that, then I would feel a little bit better about it.
That would make it better. I mean, it would make a person feel more comfortable knowing that things have been reviewed.
I'm sure it probably weighs in a little bit, but to be honest, I don't really think that plays a part, because you don't really even think that far.
You fill out the surveys, you answer the questionnaires, and you don't know what happens to the information.
Typically, the researchers have not really cared enough about their subjects to bother getting back to them.
Oftentimes, we know when things start and we know when they end, but we don't know the results. So
sometimes this information is just collected for a project and put in a file cabinet. I think that's really bad business.
Building trust, I think, really requires that once the research is done, that folks hear back what it learned and what kind of impact it's going to have.
You come in asking some real poignant questions, some really questions like, oh yeah, they're finally going to come in and work on my issue, and then nothing ever happens. And see, I just knew it was just a game. They just come in here. Next time, they'll know she even bother knocking on my door because it's just a waste of my time.
I think that if they would concern themselves with thinking of the community or the specific area that they're targeted as somebody who is important, and they are important, that would make a big difference. And I think they'd get probably a better response from those people as well.
It's not bad to sit in on a research, you know what I mean? Because you can learn a lot. People really don't realize how much they can really learn by going into a research.
Well, the research is going to help this community a lot because everybody has ideas about this neighborhood. When you come in, over the years, people have formed a lot of opinions and what ifs about this particular neighborhood, but no one really was sure of the numbers, how much help people needed, how many youth were in the neighborhood, how many seniors were there. So by us doing the research, we were actually able to come in and answer some of these questions because it was such a comprehensive survey.
Research for me is something that I use to guide my practice.
I look at it as a resource for information so I know how to do my job better. And then as a consumer of healthcare, I look at research and say, how does it make my healthcare better?
Research helps in substantiating the need to write that grant and to bring a program to the families and children I work with.
I think research on any level and all levels is highly, highly useful and productive. And I think that community agencies really, really do want to be involved.
I think some bridges could be built. I mean, people, half the battle is knowing. I think the issue is people don't know what's going on here, the good that the research has done. They just think it's just a university project. I don't know how they think it can affect their lives until they actually see some results. So I think if you build those bridges, though, and people start understanding what's going on, I think it will help that cause.